Welcome to Sales Talk for CEOs. I'm glad you're here. I'll be interviewing CEOs who have successfully scaled their B2B sales organization. In each episode, I'll start by uncovering the sales background of each CEO, dig into the strategies they use to build their sales organization, and wrap it up with what the future holds. We'll cover the good, the bad, and the ugly of scaling a sales organization. I'm your host, Alice Hyman. Welcome to the show. I'm excited because I have Barb Kinnaird with me today from Response Biomedical. Thanks for being with me, Barb.
Oh, you're welcome. Thanks, Alice, for having me.
So we're going to have a lot of fun today talking about the crazy story of how Barb got to be the CEO of her company and how she has grown sales tremendously since she started. And what's particularly exciting is she was able to expand from cardiac point of care testing into a global acute care diagnostics leader. And I'm actually going to let her explain what that means because she's the expert on that. So Barb, tell us a little bit about what Response Biomedical does and how you did move from cardiac point of care testing into that global acute care diagnostics leader.
Yeah, so Response Biomedical does what's called point of care testing, which is basically detecting disease-associated proteins in the blood in 15 minutes in order to help diagnose acute conditions. So Response originally started out as a cardiac point of care testing solution. And at a point in my career, we looked into where we were selling those tests and assessed that it was in an acute care setting. So we drove the strategy to start putting new tests onto the menu to diagnose the same diseases that were coming into those places, which would be like an emergency room where you're triaging patients very quickly.
I was just going to ask that, like, what does acute care mean? That's the emergency room.
It is, where things are in acute phase. We need to diagnose quickly. People's lives are at risk.
Wow.
It's high stress. So the product has to be super simple and easy to use.
Yeah, right. Obviously, I mean, when you go to the emergency room, everybody's moving fast and they need information quickly.
Correct. And so that's correct information.
Correct information quickly. Wow. Okay. So when you say that you were just doing the cardiac point of care testing and you moved to the acute care diagnostics, were you then testing other different kinds of things at that point?
Yeah. So most of our tests are still blood tests. Mm-hmm. But what we can do is the platform itself allows us to pick up proteins associated with different diseases in the blood. So the premise is the same, but the disease state might be different. And the way it's set up, it allows the doctors to order more than one test for a single patient, or if there's a high throughput of patients, you can test up to 36 an hour on this very small toaster-sized instrument.
Amazing. So that's really good stuff. It's important. And your company's doing important things. So take us back to the beginning. So I know you aren't the founder of this company because we met at Ace Tech and I got to hear your story, and you have some different crazy things that happened to you along the way. And I know a lot of the CEOs listening have some fun stories as well, but I think they'll enjoy hearing about it. So you were working for this company, right? And so tell us the story from working for this company to, ta-da, now I'm the CEO of this company.
Boy, that's a long story. We'll try to shorten it up. So I originally got hired by the founder. They were in a partnership with a company we all know, 3M, who had an infectious disease function, and they wanted to develop a test to control infection before surgeries. So I got hired as a microbiologist. I have a background in microbiology into R&D. So I was on that project, and through that project, I got promoted a few times in product development, developing products for 3M. And when those projects were finished, it was assessed by the COO at the time that the products I were developing were really focused on the ability to manufacture and what the customer needs were. So he pulled me out of R&D and had me work more cross-functionally with the quality system, with manufacturing, and start improving processes and making things easier to manufacture and cheaper to manufacture. And in parallel, around that same time, the CEO at that time was looking for new investors. And so in about, August of 2010, these new investors came in, took a look at the financial statements and said, we need a RIF. So there were about 120 employees, possibly a bit more, and they did a downsize to about half of that. And the way they approached it was really the top of the organization was gone. And then there were a few of us standing there. And at that time, I started working at the board level. So I started going to board meetings at that particular time. So I've seen 3 different boards at this company. I've seen maybe 4 different management teams and multiple iterations.
Yeah.
And I would say I've had the privilege of learning from other people's mistakes. Of course, by now, 6 years in, I've made several of my own colossal mistakes that I learned from. But I think ultimately, in the end, I ended up being CEO, possibly because the things I worked on were sort of going in the right direction. I would say the previous CEOs, it was hard. The sales strategy for this product is quite hard for a small company. It really is. And our competitors are the big names, right? So it makes it a challenge. So I've seen what didn't work. So I already knew what wasn't going to work. And then I had to start to try and figure it out myself. And at the time that I became CEO, I really didn't know exactly what to do. So I did Google CEO. That was one of my first things. I did read, I'm a voracious reader. I read a lot of business books, but the first thing I did was I traveled to China because our biggest partner was in China, and that's where our sales were coming from. And that would be the start of me trying to understand sales.
Yeah, I remember you said, oh my gosh, almost right after you started, you traveled to China to see exactly what is going on here. And that's, it's big when you don't have the preparation to be a CEO, right? But, even think of founders who started their companies. Many of them were engineers or, like you, a researcher of some type, and they invent something and they start a company, and then all of a sudden they're a CEO. So even though it happened in a different way, many CEOs come into being a CEO, and it's like, oh, all right, so what does a CEO do? And you kind of learn it as you go. There's no school for CEOs, right?
No, definitely. And I did have, we were public at the time, and I did have very strong mentors on the board. I had a PE firm, so I had learned from some investors. I had the privilege of learning from them and having some mentorship. But at the end of the day, how our business is run, you got to be inside the business to really understand the devil's in the details, right?
Yeah. So tell us what you found out. You became CEO because they riffed everybody. There were just a few senior people standing, and they started looking at you because what you were doing was successful. You accepted, you thought, oh, sure, I'll be the CEO. And then you took a trip to China. And what did you find when you got there?
Yeah, so a lot of things had happened in China probably the 4 years previous to me becoming CEO. So there'd been some changes. The investors had come in originally because China had been so successful. A GM was hired, and he changed out channel partners and brought in his colleagues. And so by the time I jumped on a plane and went to China and met our new partners, I was privileged enough to find out that the end market sales were very low and the inventory status was extremely high. So I think I went from celebrating my new position to, and within a week, and my husband even says it, we went from celebrating to, oh my gosh, she's really scared.
Yeah, what have I done?
Yeah. Because we were public, and I remember in the middle of the night, I phoned the chairman of the board, who was a very great mentor of mine, Lou Schuster. He's no longer with us. I still remember calling him, and he was always there for me, and having to tell him the news that our partner had been stuffing inventory and he didn't want to take the next order. And of course, I was sitting there with my cash flow statement. So I pull out the next order, and what do I see?
Oh my gosh.
So I tell him the news. We have to do a news release, and I fly back to Vancouver, and my first real team job was another RIF. So we went from 80 people down to 43, and I still remember sitting in the big foyer with everyone, and I sat on a chair purposely because I was like, I got to sit for this. This is my first, and helping people understand what had just happened. And also you're managing their anxiety because this is a big deal, and what I'm communicating and how I'm communicating it. So, so that was my first real sit down with the team after being CEO.
Oh my goodness. Wow. So that was probably a little bit like getting hit by a lead balloon. And even in a lot of ways, I guess you could say, no pun intended, but deflating.
Yes.
Like here you think, oh, great, take over this company. I'm going to be the CEO. We're going to get things really going. And you find out, oh my gosh, not yet. We've got some problems to fix here.
Right.
So you go about, and the first thing you have to do is reduce your expenses. You did that. It probably broke your heart because they had just seen a RIF, right? And another one. So I'm sure that was really hard. What happened after that? What did you start doing next?
Yeah, so there were clearly multiple issues going on. It wasn't a single prong, but obviously one of the biggest issues that CEOs always face is sales, right? If sales is going well, other things go quite well. But on top of that, as a publicly traded company, I also had 3,000 shareholders that needed a return on investment. So I was prioritizing. And I still remember trying to understand the return on investment for those shareholders. And it was, the first step was really honestly taking the company private. It was, and I did that. And part of the strategy was, can I find a partner that can help us with the China problem? Because that was a serious one. So it took me 2 years to do that. So in the same 2 years, I'm also traveling around trying to understand our sales. And I can give you an example. I mean, there was a point in time where we were Googling our products and finding our products on websites of distributors we had no idea we were partnered with. So that was an early find. I think we were discovering that even before I was CEO. So still trying to figure out who our partners were. We were finding out in the weirdest ways. And because it's a regulated industry, these products are registered in these countries and we have legal obligations. So we had to solve those problems. So we were solving the company problem from a corporate perspective and cap table perspective. We were trying to figure out who we were selling to. And then I got introduced through an old friend of mine and mentor to Shannon Susko. And she just published her book, Metronome Effect, and had been doing work with Ace Tech.
Yeah.
So I went to one of her talks, and the thing that struck me was she talked about, where does the money come from? Who's paying you?
Yeah.
And that's your core customer. And I remember going, oh my goodness, it's the channel partners that are paying us. That's our core customer. And we're so focused on end users and feature dumps and product. We're losing sight of who we need to make successful so that we're successful. So bringing that together with, look how we're finding out who our partners are, we had a chasm to cross.
Wow. That's a lot, and you've just become CEO and you're doing all this. So as you mentioned, right, sales is really important to the stakeholders, whether it's a public company or a private company. There's always somebody who expects to make money, right? Even if it's just the owner and there aren't any other investors, you still need to make money and make a company profitable. And the way we do that, of course, is through profitable sales. So here you come in and you've got all these problems, but you also recognize we've got to get sales up, right? So, what was your sales team like when you first arrived on the scene? Were there salespeople? Was there a sales leader? What was the structure of the sales organization?
Yeah, so when I became CEO, the sales team had basically been mostly fired or quit.
Oh,
So
no.
I had a longtime colleague, Angela Carter, had been in customer success and technical support. Her and I had run sales for a short period of time when the investors were looking for a new CEO, and then we'd stepped away and they'd hired a new CEO and a sales team. So we stepped back in. Right. And so immediately, I still remember the two of us. I have a picture of us zipping off to Europe. We were going to a conference together and trying to meet all of our partners. And she was, I mean, really years forward, the success of Angela was her ability to really understand the customer needs, because she'd come from R&D, understood the product, and understood how to talk to customers.
Right.
And then that helped us sort of start to identify, these are our partners. This is who we need to become partners with. And this is what they need from us. And we'd come back to the organization and, try to get the organization to help us with it. I think really within the organization, the mindset shift from the product features and the product dump and the end user to focusing on the success of the channel partner was a big shift, and it was hard. It was really hard. And I think when we talk about the founders, you were saying, founders come in, they've got these technical ideas and it's great. They go through the same thing.
Yeah.
Because you start with the development of the product, then it's, we got to be able to manufacture it.
Right.
We've got to be able to sell it. We're selling through channels. That's great. Now we need sales collateral. We need marketing material. We
have to help the channel, right? We have to support our channel.
Yeah. And we were learning on the fly. And of course, I had pressure from the top to bring in seasoned sales leaders. So I did make that mistake too. So we hired a sales leader and it didn't work. And I think I did that twice before I just pulled Angela back in.
Yeah.
And so as soon as she came back in, we happened to, at the same time through Ace Tech, be taking a course on channel management and channel development. So we had our epiphanies. She restructured the team again. And we've been doing that probably now for 3 years. We've seen year-over-year growth now we're into the 4th year of year-over-year growth. And we're still learning. We're still trying to improve. We're still, things work to a certain point of revenue, and then you've got to do more.
Yeah, that's right. Well, it's so interesting because you said in the early days before you became the CEO, you and Angela dabbled in sales.
We did.
Now, did either of you have any sales background, sales training, anything?
Nothing. And I Googled CEO later. She Googled marketing at the time. So it was really, I don't want to say it was intuitive, but we knew the relationship side was going to be important for success. And then getting into the countries and doing what we could. For the 2 years that we were going private, we were in a cash crunch too. So there was a survival mode period while we were trying to bring in this new investor. And it's hard to find investors in that scenario while we're trying to travel on a nickel and understand our partners and help them grow their sales.
So without any training, but a little bit of mentoring and, a course through Ace Tech, a couple of books, you and Angela put it together and you figured out, okay, this is what our customers need and want.
Yeah.
Very important. This is how they operate. So we have to operate this way to help them. And then you went out and talked to them.
We did. And going back to the statement that we're global, we also had to be culturally savvy. It's a very interesting thing. Yeah. It's an intuitive thing, and you have to understand how other cultures operate and be very respectful of it. So both of us have very curious personalities. So we enjoyed it. It was so fascinating to learn how other cultures do business, how they sell, because different countries sell different ways.
Sure.
I would say all of them are very relationship focused. It's very important. But there was
some countries more than others, really. It's
true.
Very dependent on the relationship in some countries.
Yeah.
So that's so interesting. So, all right, you and Angela, so you started off as CEO, and you and Angela had some experience doing sales a little bit, but so you got there on the scene. There's really no salespeople left. So you go and get Angela and go, hey, we did this before. We can do it again.
Yeah.
And the two of you are out selling on your own together, going to the different countries, talking to the partners. At what point did you say, all right, I'm the CEO and I have to run the company. I can't be the only real seller. With Angela, she's got this other piece here. But when did you think, okay, we've got to go get some salespeople and build a sales team? You said you got some pressure from the investors to bring in some real sales leaders.
Yeah.
So what happened? How did that work out?
Oh, not great. If I talk about the people, I mean, we started by bringing in someone with experience with channels, and it didn't work at all. He was from a channel, and just not really understanding potentially that we were international. The experience was more local, so not a fit. But I mean, I was naive too. I'm looking for someone that's better at me than this. And of course, I'm thinking everyone is.
Right. When in fact, you really understood it very, very well. And I do think, it is hard to hire good sales talent. And when we don't come from sales, just like you, a lot of CEOs think, oh, this person must know more than me. They've been doing sales for 10 years, 15 years, 20 years, whatever it is. So you want to trust them and think that they know. But many times our instinct is right. And in that case, it was. All right. So you had one failed channel leader. And then what happened next? Did you hire some more salespeople?
Yeah. So the next time I did have a consultant and help me do some hiring after that. And we were trying to do a little bit of work in North America. I'd already shut down the North American strategy. It's non-profitable. So we were going to try it again.
Okay.
And we brought in a direct salesperson who had done extremely well at another company, opened up the market in Canada, and brought her in to try and help us with, our strategy. And again, direct sales is different from channel sales.
It is.
Brilliant at direct sales. And she self-identified that this wasn't a fit. So that was the point when I just went, Angela, the only time sales ever grew, you were running it. Let's go for it again. And she, good on her, immediately took a look at the team and restructured it.
Great. So
survived that restructuring.
Only one. Okay. So what is it like today? Now you're 6 years into being the CEO. Is that right? And what does your sales team look like today? Or your whole, customer facing organization? Because I know you have some customer success and all that. So how do you support your customer today?
Yeah. So we have a clinical support, technical support team. And so we have 3 people. One person's brand new, because we're growing. Good. So they're really about training and the product and, building training programs and helping with the tech support line 24/7, life-threatening diseases. We got to be available.
Got to be available.
Got to be able to answer. We got to be, our knowledge has to be.
Well, because you're global, it's 24, really 24/7.
It really is.
People in other countries calling, you can't just be like, oh, sorry, we're closed. We only work from 8 to 5 Central Time or whatever, right?
Well, and they're all 24, an emergency room's 24/7 too. Right. So you've got that, we're around the clock. And then the language. So we are quite diverse.
Oh, okay.
I'm so proud of that. We've got so much diversity here, so many different countries, so many different languages, and that helps. It really does. So they're responsible for that, and they build training programs for the salespeople and for the distribution partners and for the end users.
Oh, wow. Okay. So I was going to ask that. So for your channel partners, they're building training, but also for your end users as well.
Yes. And so that's the collateral to help the distribution partner, channel partners is really what we call them, do the selling to the end users. So we're also translating. We do the translations too. And some markets have different needs. And some partners actually can do it all themselves. So there's multiple sort of types of channel partners too.
Wow. Okay. So that's what your customer success group is doing.
Yeah.
They're supporting all of that. So that's once they become a customer, they know they always have someone to call.
Exactly.
Someone's going to help them and help them in the language that they speak best. All right. Yeah.
So then there's the channel management group. So they're the ones that are managing the current channels. They're a little bit hybrid right now because they're also looking for new channels in their territories. So they own territories. They will have multiple channels in their territory. Yeah. Recently, we only have 2 of them, but both of them now have direct reports that are supporting them as well. And then we have a channel development / marketing group, which is the ones that are trying to reach out and find new partners. They're also helping us find end users. And then, Angela oversees 3 groups, and she's really trying to work on a new mindset right now, which is that collaborative selling, right? Really understanding that this is a collaboration. All of you are involved. All of you need to be part of the process. Really, so that's the shift we're making today.
It's fantastic. And I know you see this as, still so much work to be done. But I see this as a huge success story. And I know that everybody listening does too, because every CEO I've ever talked to has had a struggle getting sales set up to the point where it's really working and everybody's working together and, their sales are growing at the pace that they want them to be growing at. There's no straight path to that. No. Everybody's got this curvy path to get there, but you took a situation that was not so great in the beginning, and you have made it something that is truly working, and that is really commendable. You need to give yourself a bit more credit, because I see this and I hear this story and I say, wow, that's amazing that you did that and that you had the fortitude to go through that and say, okay, we're going to try this. Oops, that didn't work very well. We're going to stop doing that and let those people be on to their next adventure, and we're going to do something different. And I love that you pulled Angela back in because you thought, maybe we weren't trained in sales, but sales always worked when we were doing it together. So let's just go back to that. And a lot of people would have maybe thought, I shouldn't go back. I should just try to go forward. But this going back allowed you to go forward.
And it's funny because she tells a story. She can remember the board of directors and saying that the teenagers are running the show the first time we were trying to do it. And it's a good point she made. It's like, because you aren't really sure, you might be more innovative about how to do the sales. You don't have constraints. You don't have this is what it should be. I mean, what the outcome needs to be, but the how, you're going to be agile and you're going to move and you're going to try again and you're going to try again because you don't have a preset way, which may be some of the, the lack of success with some of the previous people, because it worked really well at another organization. Don't get me wrong. They were successful somewhere else, but this is hard. And we're competing with a big Roche or an Abbott. I mean, these are big brands that, they already have trust because I'm that brand. We have to build trust. We have to, really prove ourselves. Right.
People know the Roche name. They don't necessarily know your name, but they're learning it now. And of course, you're giving them excellent results. So that's what matters. And that is going to help you continue this strong growth. All right. So we've been back in time and now here we are today. You've got things running pretty smoothly. I know from our conversations, you still want to make improvements, which I really admire. What do you think your sales team will look like in the next couple of years? Where do you see adding to your team and growing? So we all know that today it's not just sales is not about sellers, right? Sales is about the way the customer wants to buy. So what kinds of things are you thinking about now as to how your customer wants to buy and how you can best support that? So as you add team members, What does that look like for you?
Great question. So for the sales team structure, I think we're on the right path with the core customer being the channel partner. And it's a little bit differentiated in this industry. So I think it helps us because they feel the love. So we would continue with that strategy. I would like us to be able to have more in-country support, right? So everything's coming from corporate office right now. So expanding and being able to support them in person more quickly and easier from local territories would be one vision of the future. So in the team structure, we are wanting to streamline the product and make the product easier to use, which will help us get into more decentralized locations, because I have a vision of, we can be in big hospitals and big centers and emergency rooms, but what about those locations that are decentralized where people aren't getting the access to healthcare that they need? So to do that, we want to make our product really easy, simple, and user-friendly so that those locations don't have to be as big of experts, and they can use the product and it help guide them to deal with those remote issues that are also emergency issues but have the problem of delivering patients. So we're working on a project to do that, which would also help us expand into new countries globally. So of course, we have a 3-year plan, and oh my goodness, we're going to have to find partners for that. We have to start that big deal strategy now. So we're ready at the right times. And then of course, we are trying to streamline and scale manufacturing to support sales and pricing pressure, because the industry is managed by reimbursement strategies, which are funded by, taxpayers and government. And so the pressure is quite big. So we have to keep cost of goods very low for the sales team to be successful in these areas.
Right. I think people who live outside the U.S. forget that most healthcare is provided by the government.
Exactly.
And so they definitely want to keep the costs low, which is, we appreciate, but it is hard to do. And especially when you have big competitors. So you really, in order to enable sales, have to keep the manufacturing innovative and cost effective so that the salespeople can go out and be competitive.
Right. And deal with price pressure.
Right. Wow. Well, I love your future vision. And I do think that having feet on the ground in some of those countries will be very helpful, even if they're there part-time and maybe travel between 2 or 3 countries. But then you've got to find all these multilingual people, which is also very interesting, right?
Yeah. And hiring, we did have that in the past, and I shut that down because we didn't have enough control over what they were doing. And I said, why don't we start at head office, build the sales team here, and then get to a point where we're mature enough to be able to start hiring, like you said, maybe it's somebody in the Middle East that's doing multiple countries, or someone in Europe that's doing. So I think we're not quite there, but we will get there.
Yeah, and hiring, onboarding, and managing someone from afar is a whole nother set of skills that someone has to have, because that's not easy. So that's another piece of it to think about how to do that. Well, you certainly have a lot going on, and I applaud you. And so if you were to think about what are the things that are really helping you to be able to move forward and keep improving the way that you're serving your customer, what are some of those key things that you do? I know Ace Tech is one of them. Certainly they provide a lot of support to you, and also education. And for those of you who are listening who may not know what Ace Tech is a CEO organization in Canada that supports the CEOs of tech companies specifically. And they meet in small groups with a facilitator, and that facilitator helps the CEOs, to talk about their businesses and help each other. And also the facilitator gives ideas as well so that the CEOs can continue on this path of growth. So I know that's one thing. What are some other things that you do to, when you're not sure. You mentioned you had a few mentors, and what are the kinds of things that you do to help you feel sure when you're making a decision, and especially about the area of sales and growth?
Oh, good question. I am a bit of a risk taker, so which is why I have to be agile, because if I make a mistake, I can move. And definitely the ACE Tech thing is, communities are needed to grow businesses. So that's a huge thing for me, to talk to people, to learn from them. I'm a voracious reader, so I read books, and Shannon helps us always know what the next leader or thought leader is thinking about the business. And I think, more recently, I'm pulling myself a bit more out of the business so that I can be more that support and evangelist. I think that's the wording you use, for the company and for the sales team. So I'm sort of on the crux of doing that. And keeping the culture going in the right direction. I think the levers we have, right, our culture, strategy, making sure you're enabling everybody to keep going in the right direction. So enabling the leaders.
That is your job, truly, as CEO, right? Supporting everyone to do what they do best.
Yeah.
Not knowing how to do everything, but getting the right people around you who do know how to do the things that need to be done, and then making sure you clear the path so they can do it.
Exactly. Get out of the way. That is my mantra. Let them succeed.
Well, Barb, thank you so much. This has been a pleasure talking with you and letting our listeners hear your journey. And I know they can all commiserate with you on, some of the ups and downs of trying to get sales on track, but it sounds like you have it on track now. It's all going in the right direction. You're getting the growth that you need, and it sounds like you've got great plans to continue that growth. So thank you so much for being here.
Well, thank you, Alice, for having me. It was a great honor, and it was super fun talking about it. So thank you.
Thanks for tuning in to Sales Talk for CEOs. You can find me at alicehyman.com. Be sure and connect with me on LinkedIn and let me know that you heard the show. If you found value in today's episode, please subscribe, write a review, and share the show with another CEO.